preventing gestational diabetes, as well as any complications associated with pregnancy, are the main goals of obstetrics and midwifery. Investigators at the University of Toronto, in Ontario, Canada, looked at antipsychotic drugs and whether they could be safely used during pregnancy. Their research, reported on in the British Medical Journal in May 2015, included women who delivered their baby between 2003 and 2012. A total of 1,021 women who had taken antipsychotic drugs during pregnancy and an equal number of women who had not were entered into the study. It was found that women who took antipsychotics were 10% more likely to develop gestational diabetes, 12% more likely to have hypertension, and 5% less likely to develop clots in their legs than women not taking antipsychotic drugs. Infants whose mothers had taken antipsychotics were 2% more likely to be born premature. From this information it was concluded, although the impact of taking antipsychotics was not great, it was great enough to warrant using caution in treating pregnant women with psychiatric disorders. Earlier reports have also suggested a link between antipsychotics and gestational diabetes. In December 2014, the publication Expert Opinions on Drug Safety reported a review of literature on the subject. Literature on antipsychotics and gestational diabetes, published between 1996 and 2014, was analyzed at the Mental Health Center in Salerno, Italy. A total of 18 articles concerning gestational diabetes were reviewed. 5 studies associated clozapine with gestational diabetes, 9 reported links with olanzapine, 2 associated the condition with quetiapine, and 2 reported an association with risperidone. From these studies it was also concluded antipsychotics during pregnancy could present a safety problem. In 2012, a report from the Karolinska Institute in Stockholm, Sweden, reported an increased risk of gestational diabetes in women taking clozapine, olanzapine, and several other antipsychotics. The article, published in the Archives of General Psychiatry, noted that olanzapine and clozapine increased the risk of developing gestational diabetes by 94%. Other antipsychotics increased the risk 77%. On the other hand, it takes emotional stability to be able to manage pregnancy, stay healthy, and produce a healthy child. Other ways of lowering the risk for gestational diabetes include maintaining a normal healthy weight, eating a variety of fruits and vegetables, and following a plan for regular exercise. Pregnant women need to gain only as much weight as their doctor or midwife advises, most of it during the last 3 months.